Hello, I'm Michele Heisler. I'm a primary care physician, a professor of internal medicine and public health at the University of Michigan, and medical director at Physicians for Human Rights. And I'm excited to give you a brief introduction to the many, many ways that health professionals, clinicians, health services researchers, public health officials can play in defending and promoting human rights. I'm just going to give you a tiny glimpse in this next 15 minutes. So health professionals can play a unique role, really complementary but different to other human rights experts, legal professions. Health professionals can leverage their clinical expertise and use of scientific evidence to document violations and critically, the health effects of human rights violations. Health professionals are trained and have objectivity, rigor, credibility. There is very strict guidance by professional ethical obligations, good training to assess and seek to alleviate pain and suffering. And often clinicians, as well as public health officials, are often at the front lines in a position to witness the health harms from human rights violations, and often the first people to be aware of human rights violations. There's certainly the influence and reputation of the profession. There's an international network of clinicians and health professionals that can be mobilized, and kind of an international language and way of communicating. So I wanted, in these brief couple of minutes, I picked just a couple of areas of the many to give you some examples of different roles that health professionals can play in a number of critically important human rights situations. And in these, I am going to focus a little bit on the role that clinicians can play. A lot of clinicians, there are more clinicians that aren't necessarily trained in epidemiology or other health services research or other approaches, but anyone with clinical skills is trained and can play the role of what I'm about to talk about. So one of them is documenting torture and ill treatment. The second is the role in supporting claims for political asylum of people who are fleeing persecution, and the role in documenting attacks on health workers, witnessing and documenting those attacks. I personally, a lot of these examples that I'm drawing on are from my role in Physicians for Human Rights, which is a health and human rights organization that really does seek to work at the intersection of medicine, science, and law to investigate and document health effects, amplify the voices of survivors and witnesses, provide medical legal evidence for accountability, and to really develop a network of health professionals and clinicians all over the world. So again, using these core disciplines of science, medicine, forensics, and public health. So what are some of the methods? I'm going to run through these. And again, I know a number of you will be clinicians, but also others of you will also be trained as public health or health investigators. So again, I'm going to talk a lot about clinical assessments, analysis of physical evidence, x-rays, other imaging, DNA, wounds, doing a case review of medical records. So, clinicians understand the language of medical records and can pull evidence from those. Doing semi-structured and structured interviews with survivors and witnesses, and then some of the just standard medical health services skills are population-based surveys, often cross-sectional in the case of human rights documentation, field observations, going into detention centers or prisons and looking at the conditions, doing systematic reviews of peer-reviewed medical evidence, and reviewing medical legal affidavits, as well as forensic investigations of pathologists doing autopsies or looking at crime scene assessments. Unfortunately, torture remains a global phenomenon. Over half of all countries continue to practice torture, even though it's been prohibited. You look at all the states that have ratified the UN Convention Against Torture, but on this left side, you see on the red all the places where between 2007 and 2018, sadly, this has increased since then. There have been allegations of torture. And I will just say that these are examples of torture in detention centers, prisons. When you actually look at other types of activities that really should be considered torture, like beating up protesters, really, attacks on marginalized communities, this does not even count those forms of torture that could be clinically documented. So one tool that clinicians played a big role in developing is the Istanbul Protocol, which was initially in 2019, and then it was revised in 2022. And this is a manual that really creates a framework for the systematic investigation and documentation of alleged torture. It really provides a guide to how do you document physical and psychological evidence? How do you interpret this? How do you correlate the degree of consistency between all the data you've gathered in your examination and the findings? And then the idea is to write this up, to communicate this in a formal document for accountability in courts and other tribunals. So when I talk about a medical legal conclusion, what I mean is that it's really a medical opinion regarding the possibility of torture or ill treatment based on the sources of evidence that the clinician has in front of them. So physical and psychological findings, really understanding the history, consistency of historical information. You may have photographic findings, diagnostic test results, medical records, and also just understanding regional practices of torture and how what you're observing fits into those. Again, this does require training to really interpret the findings. So the categories that the clinician would use are: is this not consistent? It just couldn't be caused. It just doesn't make sense. It's consistent, highly consistent, and then diagnostic. There's certain wounds that really can only be caused by certain types of physical torture. And the type of questions that you might ask, again, as in any clinical training, questions for physical symptoms and signs are in this blue box. Do the injuries match the allegations of ill treatment? A number of other questions. Similarly, for psychological symptoms, are the psychological symptoms consistent with what you might expect from the story that you're hearing? Key point for clinicians doing this type of documentation is that the absence of physical or psychological findings must never be construed as evidence of the absence of torture. And again, sometimes a good assessment will say why. This is a resilient person. They have good, strong religious faith. So, even if this was traumatic, they have good social support. So sometimes you can talk about those modifying factors that contribute to not finding signs, or a lot of physical symptoms. Like, these are scars that would have healed. Sadly, rape, a year or so after, there's going to be no evidence necessarily of rape. This is an example of a conclusion, just to give you a sense of what you might do if you are trained to do these. Basically saying that all this evidence described is highly consistent with the degree and types of physical and psychological trauma. This was actually an Istanbul Protocol exam I did, and it was actually of a protester who was hit by a rubber bullet. So, the case of the rubber bullet injuries, the shape, depth, clean margins. First, in terms of the current physical symptoms, as a healthy young man, we would not expect him to have continued physical symptoms from this. And then again, talking about the physical conclusions, the continued symptoms of altered arousal and reactivity, all these different symptoms of PTSD are highly consistent with a traumatic event. So that gives you an example of the type of conclusion you might draw in one of these. And I will say, I think a number of US clinicians are familiar with doing medical legal affidavits to support claims for political asylum. It's the same Istanbul Protocol-based medical legal affidavit. Again, many people who are fleeing have suffered torture, ill treatment in their home countries. So it's very much the same thing. And these medical legal affidavits really dramatically increase the success in asylum claims. One recent study that we did showed that threefold increase in successful claims for asylum. There's a wonderful network across the US of medical schools that have PHR-affiliated asylum programs, many of them led by medical students, where they do these pro bono forensic medical and psychological evaluations, really working only with pro bono lawyers to make sure you're getting, truly cases of political asylum. And again, just the really critical importance of these affidavits. This is a quote from a pro bono lawyer saying that, both cases were reversed this morning, and the judges cited the psychological evaluations as the main reason. So again, this lawyer said, please, 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 let's push to have at least one psych volunteer every week. It makes a huge difference, especially on our most challenging cases. As I mentioned, we need to think of torture and ill treatment beyond detention centers, beyond what are called carceral settings. This was a report. This is a field investigation that I led in Portland in July of 2020, when, as you may remember, federal forces joined local police. There was really horrible excessive use of force against protesters. And we actually focused in on the attacks on street medics, people who clearly were neutral, providing medical assistance. And so again, we used the same techniques that I'm telling you about. We did interviews, and then here I'm actually doing a physical examination on one of the medics. As he said, I was working as a medic. I was clearly marked, with the crosses, and I was holding my hands up in the surrender position over my head, saying as loud as I could, I'm a medic, checking injuries, don't shoot. But the guy pointed the grenade launcher and shot me with a 40mm CS canister. That's a tear gas canister that hit him, that hit my left thigh. I turned in pain, and they hit me with a rubber bullet on my right lateral thigh, and then he actually got a canister right, as you can see, to his chest. So again, just using good clinical skills. And I think that was about, I don't want to take more time. I have one more case example of attacks on healthcare, but I really will stop there. I want to just give you a couple of examples. I have a longer presentation where I can give many more cases and examples of the role of clinicians and public health and health services researchers in documenting human rights violations. But again, I just, for many of you who may not have done this work, there are many more ways that physicians and other health professionals can use their clinical skills and expertise to defend and promote human rights and health. And this is a wonderful study that Irvin Staub, a psychologist, led, really understanding rescuers during the Holocaust, and kind of, wow, how were these people, how did they show this moral courage? How did it start? And he concluded that goodness, like evil, begins in small steps. Heroes evolve, they aren't born. Very often, the rescuers made only a small commitment at the start to hide someone for a day or two. But once they had taken that step, they began to see themselves differently as someone who helps. What starts as mere willingness becomes intense involvement. So again, if you're interested in this, start small, but no matter what you do, even if it's a small step, there's a lot you can do. And if you're a clinician, health professional, really to help promote and defend human rights. Thanks.